everyone, today in Dynamic Talks I have board certified Dr. Scott Loessin with me, and we're going to be talking about body dysmorphia. Welcome, doctor.
Thank you. Thanks for having me.
Of course, a pleasure. I've been chasing him for months, so you all are very lucky that he has 15 minutes for us today. Off record, we were talking about if you could, or how could you distinguish a patient with body dysmorphia? How do you know which patient, or if a patient has body dysmorphia?
As I mentioned earlier, I think I could sit in a different room and just look into this room and pick out the patients that have it because they look overoperated. They look like they've had too many operations on their nose or too many operations on whatever part of their body. Clearly Michael Jackson had it. And if you would have looked at him as you did before he died, you could see it. You could see that he had too many surgeries on his nose in his particular case. And then the other thing is that if you talk to a patient and you ask them, why do you want this surgery? And the answer isn't as you would hope it would be, that also would lead you to that diagnosis. For example, if someone said, I'm not doing this surgery for me, I'm doing it for someone else, and I'm hoping as a result of the surgery, all of these things happen to my benefit.
Right.
That's not right.
Right. So now that we're talking about red flags, what are other red flags? Or like when you interview a patient, a potential client, right? A potential patient, what are some red flags for you? Like you would say, I would not operate on you, or we're not a fit, or this is not.
Yeah. I think if they let's give you an example, let's say if they had a lot of different operations on their nose and they came to me, I would be suspicious. If they come to me with a complaint of something that I can't even see, some people feel that a certain part of their face or body is something that in reality is not even there. Right. Those are things I can't operate on.
Right. And how do you distinguish patients with realistic versus unrealistic expectations?
Realistic expectations are things that I think I can surgically perform. Unrealistic expectations would be something that would be more magical and less surgical.
Right. But it happens, and I ask that because we see it all the time that, and I've seen in all these TV shows, right, that they go with a picture of Kim Kardashian and like, I want to look like Kim Kardashian. Yeah. And they look nothing alike. So that would be an unrealistic expectation, like that you could see based on your naked eye, like you guys are not alike, so it's very unlikely that you're gonna look like Kim Kardashian. But it happens all the time. So that's why I was asking your professional opinion, because I'm sure you've had patients who come with pictures or certain requests that are not realistic for their body type or for their genetics. Right? Yeah. So what do you do in that case? Like, how do you handle that situation?
Yeah, I'm just really straightforward with them, and I tell them, let me give you a really good example. Is when I do breast surgery, I always ask people to bring pictures of the breasts that they like. Right. And so they do that, and if they're bringing me pictures that I don't think are related to their particular body, I always say to them, this is a great surgical result that you're showing me, I agree, but can you show me what this person looked like before surgery? And does that person look like you?
How about if it's a patient who's going to have their first surgery, a patient who has body dysmorphia, right? Or who has these ideas or not based in reality, who finds all these little defects that nobody else can perceive or can see, and it's coming to you for surgery. It's a first time, so obviously they're not going to look like they have been over-operated on. So what do you do, or how do you handle that initial evaluation?
That's a tricky one because now you don't have any physical evidence that they have that diagnosis. Right. So you really have to spend more time with them. Ask, like I said before, ask them what is their motivation for this surgery, and is the motivation something that is more related to their self. It's just something they want versus something they think they would benefit from in a different way.
And have you ever operated on a patient that you later on regretted that you had taken that case?
I think every plastic surgeon probably has.
Mm-hmm.
So I definitely think I'm no different than anyone else. And there's, over the past 30 plus years of doing this, there's, I'm sure, a couple people in there where that answer to that would be yes.
It happens. Like once you've been practicing for over 30 years, it's bound to happen. And that's why I was asking about realistic versus unrealistic expectations. Sometimes people can have realistic expectations, but then genetics, environmental, post-op care, follow-up care, and they don't follow the instructions, right? And then the
Right.
results are not what they initially expected.
Exactly.
So then what happens, or do you explain to patients like, this could look like this, but you gotta follow genetics or environmental, you gotta stop smoking, you cannot drink, obviously no substances in certain things, or not exercise for, like, what's the usually follow-up care that you recommend to patients?
Just basically what you just mentioned. I mean, just good common sense and doing all healthy things, and not becoming too active before you're fully healed. Usually at 6 weeks. Some people are good at taking it easy for 6 weeks, and some people aren't. So yeah, just really healthy things.
I know, and I know that it sounds like common sense, but common sense is the least of the common senses sometimes. And people don't know what that means. So people think, oh, that's fine, like it's not gonna be a problem, it's not gonna cause, for example, smoking. A lot of people smoke and they don't think that could affect healing, right? Yeah. Because they don't think much of it, because they don't have that knowledge. So usually what are some instructions, or what are some steps that patients who are gonna get surgery before surgery should take?
We tell everyone to stop smoking for preferably 2 months before surgery. If you don't have that amount of time before surgery when you first see the patient, then you just tell them that their last cigarette was yesterday. Just have them stop for as long as possible. And then we like their nutrition to be as good as possible. Make sure they're not deficient in any vitamins. Yeah, we give them a lot of instructions with the medications that they can't take before surgery. So, anything that causes bleeding, they shouldn't be on for 2 weeks before surgery. So, yeah, they get a lot of different instructions.
And I'm asking about that because obviously all those factors affect outcome.
Right.
Pre and post. It's a combination.
Yeah.
So it plays into realistic and unrealistic expectations. And you might have realistic expectations, but if you don't follow the pre-op and the post-op care, your results might not be what you desire, what you want, or what you envision, right?
Right.
I know we were talking earlier, and you do a lot of reconstructive surgery, which also is very important because some patients, it's life-changing for them, right? But at the same time, I also wonder about if those type of patients also have realistic or unrealistic expectations, because sometimes it depends on the degree and the severity of the reconstruction. It might look like before, or it might not. Right. So in that case, with reconstructive surgery, how do you go around it? How do you go about it? Is it the same way? Is it different? Because these patients have been through trauma, like physical trauma is what I mean.
For a cosmetic patient, you're taking usually a normal looking person and trying to make them better. Right. And if that doesn't work out, they just go back to normal. But in the case of a reconstruction, you're taking a problematic patient, whether it be from a car accident or a dog bite or what have you, and you're trying to get them back to normal. So I think that I'm very honest with them in the beginning that it's probably going to take more than one operation to get you where you want to be. And so most of the reconstruction I do is in stages. And we do, every time we meet a new milestone, and then maybe sometimes after 6-7 operations, we're back to as good as we're going to get. And hopefully that's back to normal, but not always. Not always.
What do you think certain surgeons, even though they could see that patients are being overoperated on, they will still do the procedure instead of saying, no, I want. For example, Michael Jackson. We go back to, he had multiple rhinoplasty, right? Multiple nose jobs. So what do you think some surgeons will say yes when the obvious answer should be no?
I think they're probably just not using their best judgment, and I think that, you know, they think that operating on a celebrity would be something good for their career. I had a professor once upon a time tell me that you make your money on doing your operations, or you make your money on the people you operate on, and you make your reputation on the people you don't operate on.
Mm-hmm.
And I thought that was a clever saying.
It is. Because it also happens, and I go back to unrealistic expectations. If you operate on somebody who does not have realistic expectations, that's going to be a dissatisfied patient.
Yeah.
That's going to be a bad review. That's going to be, I don't know, sometimes a lawsuit. That's going to be a lot of bad and negative consequences down the road. So let's say the patient is not famous. It's just a patient that you could see with body dysmorphia, and we've seen that these patients get overoperated on all the time.
Yeah.
What do you think they're doing? Just financial gain, or maybe they're thinking that they're trying to help? But
yeah, I don't know. I mean, that's a really good question. I don't know the answer to that. I think that most of the people that come to me that I know have body dysmorphic syndrome, most of the time they're asking me to do something that either I know I can't do, or I know they're not going to be happy with it, and so I don't do the surgery. But again, I've been doing this for over 30 years, and it might have been harder to do that when I was only 3 years into my practice.
Yes. Experience, right?
Yeah.
It becomes easier to say no, or distinguish when to say no.
Right.
Yeah. That when you're starting, maybe you don't know, and maybe you think you could help, or you can make a difference, when you know later on that you wouldn't have made any difference.
Right.
So yes, that's a good one, and I like to end with that experience, right?
Yeah.
So it's so important, and that's why I always say practice makes perfect. And it's so important to talk to patients and to get to know them and to really know the reason why they're doing these procedures. Is to better themselves or for somebody else. Is it based on something that you cannot see, I cannot see, anybody else can see but themselves. Right. So I hope that this topic was useful and instructive, and thank you so much, doctor, for coming in today.
Thanks for having me.